Welcome to our SCI Educational Series number 2 on Enhanced Patient Safety. Today's presentation focuses on tracheostomy care and emergency management in SCI nursing, which is highly relevant to our daily responsibilities. Many of our spinal cord injury patients, particularly those with cervical level injuries, rely on tracheostomies for survival. Our expertise directly influences whether these patients thrive or face complications. I am Michael J. Orellano, your SCI nurse educator. The goal today is to ensure that every nurse here feels confident and prepared to assess, prevent, and respond to tracheostomy-related emergencies. This isn't just about clinical knowledge, it's about safeguarding lives and empowering our patients toward better recovery and quality of life. Let's walk through practical, evidence-based steps together so we can uphold the gold standard of care our veterans deserve. Our key objectives of today's session are: first, you will be able to learn to recognize the early clinical signs and symptoms of common tracheostomy-related complications, such as infection, dislodgement, or mucus plugging. Early detection is essential in SCI patients who may not be able to communicate their symptoms effectively. Second, you will be able to apply evidence-based protocols during routine care and emergencies. These protocols are designed to minimize risks, maintain airway patency, and ensure sterility. Finally, the presentation emphasizes the value of interdisciplinary coordination, particularly with respiratory therapists and other healthcare professionals. You will be collaborating effectively enhances emergency preparedness and supports ventilator weaning processes. These objectives are anchored in improving patient safety, optimizing team performance, and promoting a culture of clinical excellence in tracheostomy care. This learning will help us uphold the highest standards of practice. Let's start. Tracheostomy management is especially critical for individuals with high-level spinal cord injuries, particularly those at or above the C3 level. These patients often experience compromised respiratory function and are reliant on tracheostomy tubes for survival. The associated risks, such as accidental decannulation, mucus plugging, or respiratory infection, can quickly escalate into life-threatening situations. Effective nursing care begins with an awareness of these vulnerabilities and the confidence to respond rapidly and competently. Continuous staff education ensures all healthcare providers remain updated on best practices, reinforcing their clinical judgment and ability to detect early warning signs. Education also promotes team-wide consistency in delivering safe, high-quality care. Given the complexity of respiratory care in this population, heightened vigilance and routine training are not optional. They are essential for safeguarding airway patency and patient outcomes. Thorough tracheostomy assessment is a foundational aspect of nursing care in CI units. Monitoring airway patency involves checking for clear airflow through the tracheostomy tube and ensuring that the tube is securely positioned without dislodgement. Tube placement must be confirmed at every shift and after any patient repositioning. The stoma site should be evaluated for signs of infection such as redness, swelling, discharge, or unusual odor. Additionally, many SCI patients have impaired neurological responses and cannot verbalize discomfort or distress, making it imperative to observe subtle cues like increased respiratory rate, agitation, or labored breathing. Respiratory effort and secretion characteristics should be carefully documented and communicated during handoff reports. These assessments are not merely routine, they are essential safety checks that protect against silent but potentially fatal complications such as tracheitis or mucus plugging. How do we prevent complications? Preventing complications in tracheostomy care begins with maintaining strict adherence to sterile technique and infection control standards. Clean hands, sterile gloves, and proper handling of equipment are non-negotiable aspects of every tracheostomy procedure. Humidified oxygen therapy is crucial for preventing the drying of airway secretions, which can otherwise lead to mucus plugs and respiratory distress. Consistent humidification maintains mucosal hydration and facilitates secretion clearance. Furthermore, frequent suctioning tailored to each patient's respiratory needs helps prevent secretion buildup. For SCI patients who often lack the ability to cough effectively, suctioning is a life-saving intervention. Hydration protocols, whether through oral intake or intravenous fluids, further aid in thinning secretions and maintaining airway patency. These preventive measures, when implemented with discipline and regularity, greatly reduce the risk of respiratory infections and subsequent hospital readmissions. Importance of emergency management. Emergencies involving tracheostomy patients can be sudden and catastrophic, particularly in the SCI population. Accidental decannulation, if not addressed immediately, can result in rapid hypoxia and cardiac arrest. Recognizing the signs of respiratory compromise, such as cyanosis, stridor, or agitation, is the first step toward life-saving intervention. Nurses must be prepared to perform emergency suctioning when patients exhibit symptoms of airway obstruction, ensuring airway patency is restored promptly. Every facility has a specific emergency algorithm that guides step-by-step responses in such crises. Familiarity with this protocol is essential for all staff members, and emergency kits must be readily available at every bedside. Routine mock drills and simulation exercises are recommended to reinforce muscle memory and ensure confidence during real events. Properly trained, alert nursing staff can make the critical difference between recovery and tragedy in tracheostomy emergencies. Why safety is essential in tracheostomy care. Ensuring safety in tracheostomy care is not only about preventing emergencies but also about enhancing long-term recovery and patient dignity. SCI patients are especially vulnerable due to their reduced mobility and compromised respiratory function, making airway safety a top priority. Consistently delivered, evidence-based tracheostomy care reduces infection rates, lowers the frequency of hospital readmissions, and enables successful ventilator weaning and, in some cases, tracheostomy decannulation. These milestones significantly improve a patient's quality of life. In addition to the clinical benefits, tracheostomy safety reinforces the vital leadership role nurses play in SCI rehabilitation. Nurses are not only caregivers but educators, advocates, and coordinators of interdisciplinary care. Through excellence in airway management, nursing professionals directly influence the patient's recovery trajectory and foster hope. The nursing team's attentiveness and dedication become the foundation upon which patients rebuild their independence. A routine tracheostomy cleaning is very important in your care. Routine cleaning of the tracheostomy site is vital in minimizing infection risk and preventing complications such as granulation tissue, mucus crusting, or cellulitis. The cleaning process should follow a standardized protocol tailored to the SCI population, considering their limited ability to manage secretions and detect discomfort. Maintaining the integrity of the skin surrounding the stoma helps prevent pressure injuries and reduces the chance of bacterial colonization. Sterile technique must be used at all times to avoid introducing pathogens into the tracheostomy tract. This includes the use of sterile gloves, swabs, and cleansing solutions. Supplies should be checked daily for expiration and cleanliness. When this routine is performed diligently, it not only ensures patient safety, but also contributes to continuity of care. Nurses must stay proficient with the latest care guidelines and educate caregivers or patients whenever appropriate to sustain high standards of infection prevention. Collaboration with respiratory therapists is essential. Collaborative care between nurses and respiratory therapists plays a pivotal role in managing tracheostomies, particularly in patients with high-level SCI who are ventilator-dependent. RTs are instrumental in setting up and troubleshooting ventilators, ensuring proper functionality, and making timely adjustments based on the patient's condition. Nurses must verify that backup airway equipment, including spare tracheostomy tubes, suction devices, and bag valve masks, are readily available at the bedside at all times. During respiratory emergencies or ventilator weaning, seamless coordination between nurses and RTS ensures a timely and organized response that enhances patient safety. Regular interdisciplinary communication not only improves patient outcomes but also fosters mutual respect and knowledge sharing across disciplines. Joint training sessions, shared care plans, and huddle discussions strengthen team collaboration, all while centering care around the needs of the SCI patient. So, what do we learn? In closing, effective tracheostomy care is not just a task, it is a life-preserving skill that lies at the heart of SCI nursing practice. Every assessment, cleaning procedure, suction, and emergency response directly contributes to the safety and recovery of patients who rely on artificial airways to survive. As frontline providers, SCI nurses are uniquely positioned to identify early signs of deterioration, implement interventions swiftly, and prevent unnecessary complications. This responsibility underscores the importance of ongoing professional development. Continued education, peer collaboration, and participation in simulation-based learning sharpen clinical acumen and strengthen teamwork. These activities foster a high-reliability culture where excellence in tracheostomy care becomes second nature. As healthcare professionals dedicated to our nation's veterans, we owe it to our patients to stay current, remain vigilant, and advocate fiercely for their respiratory well-being. Together, through teamwork and dedication, we ensure every breath counts. The references listed here reflect the most recent and relevant literature in tracheostomy care and SCI nursing. Staying grounded in current best practices ensures we deliver care that is safe, effective, and evidence-based. These resources provide guidelines and case studies that help refine our clinical judgment. As a team, we must take responsibility for staying updated and sharing new information with one another. The more we learn, the better we serve. Let's keep these resources in mind as we move forward together in providing top-tier care for our SCI patients. Thank you for your valuable time and attention. I hope that this presentation has made a meaningful impact on your professional practice. Please stay tuned for the next installment of the SCI Enhancing Patient Safety Educational Series scheduled for next Wednesday. Looking forward to your continued participation. Wishing you a productive and rewarding day ahead. Again, thank you very much.